Get started now. I want to thank everybody for attending. This is the first of a 4-part series, Cattle Conversations. Of course, this is virtual, and if you do know of anybody who is interested in seeing either this program, we will have it recorded, or later programs, invite them to register, and we would be happy to have them on. So first of all, I would like to, if it'll go forward, I would like to introduce our group. This is a group that has done some planning over this last year, especially going virtual. It was good to collaborate and know what all of you guys were interested in learning about and talking about. We have Justine Henderson. She is the livestock agent in Central Kansas District. Clint Laughlin, he is the livestock agent in Midway District. Brett Melton, he is the livestock agent in River Valley District. Sandra Wick is pulling double duty right now, regularly a crop production agent, but in the absence of a livestock agent in her district, she is taking on the livestock duties as well. And then my name is Alicia Bohr. I'm one of the ag agents for the Cottonwood District, and most of my programming is livestock. Just a little bit of housekeeping. When you are asking a question, if you would click on the chat box icon and put your question into the chat, we will ask the questions at the end of the program. Just for time's sake, since we're trying to keep these under the 30 minutes, we would like to hold all questions to the end. You can also email your questions to swick@ksu.edu, or any of us other agents. If you have our emails or phone numbers, you feel free to ask us any way that you can, and we will get those questions asked for you. Now, without further ado, I would like to introduce Dr. Gregg Hanzlicek. He is the Director of Production Animal Field Investigations. He assists private practitioners in investigating complex herd health problems. He's a course coordinator and primary instructor for cow-calf health systems, and his research interests include disease surveillance and monitoring systems for beef and dairy health programs and disease surveys. So, without further ado, I am going to stop sharing my screen so that Dr. Hanzlicek can share his, and we will get going.
Thanks, Alicia. Can you all see the screen there? See my notes, my presentation?
Yep, yes, we can.
Well, appreciate the opportunity to be here and be a part of this. The thing I miss for this COVID thing, quite frankly, is the opportunity to go out in Kansas and have face-to-face meetings with producers. I really desperately want to get back to normal so we can go back to that, but do appreciate everything that you did to put this together, Alicia. So it's what we have to do today, and hopefully next year we'll be meeting in Western Kansas somewhere and having discussions. So I was asked to just talk about pregnancy loss and a little bit of understanding as much as we can, and then going into how do we diagnose what went on when we experience pregnancy losses in the cow-calf herd. So one of the most important things to do, at least in veterinary medicine, we have definitions. And so a fetus that's lost in the first 42 days of gestation, we're going to call that an early embryonic death. And then fetuses that are lost from 42 all the way to term 280 or 283 days, we're going to call that an abortion. And the reason that differentiation is important is that if we know we have an early embryonic death problem and not an abortion problem, we're going to go one direction to try to solve the problem, versus if it's an abortion, we're going to go a different direction. So it helps us a little bit define what direction we need to go to diagnose it and prevent it from next time. The other thing I want to bring up is the concept of stillborn versus weak calf syndrome. A stillborn issue in a herd can be a lot of times totally different than a weak calf syndrome. And it's important that we know which, or when we have calves like this, which is which. And so one of the things as producers that you can do to determine whether the calf was actually alive during the birthing process is just open up the chest, take a little piece of lung, throw it in the water, in a bucket of water. If it floats, then you know that calf was at least took one breath. And so that would be, that would not be a stillborn. That would be more of a weak calf syndrome. So just some definitions there. So one thing to understand is that pregnancy losses are normal in all species. All species are going to have some loss, some attrition. Last year, I went back into the literature and went way back to 1960 all the way to 2020. There's hundreds upon hundreds of research and case reports talking about pregnancy losses in all those species that I have listed there. The ones that are the most researched are actually mares, cows, and humans. They have the most papers. And so we can always expect some loss. And the thing is, we just don't want to get to a loss that's actually an epidemic. A couple of recent studies to kind of give us an idea of when most of our pregnancy losses occur. And on the vertical axis over here is the percent that were pregnant at one particular time. And then down here is gestation. So the top study in the purple, 100% of these animals conceived, and then they followed them through time, and most of the loss was done that occurred the first 30 days. 40% of the fetuses were lost, and then it leveled off. Second study, conception was not 100%, but again, the same trend. And what we say is that most of our pregnancy losses are going to occur in the first 30 to 60 days. You're not going to notice that because typically the fetus is either going to be absorbed or shed out the vulva, and they're so small you're not going to see them. These animals are going to recycle, and they'll become, a lot of them will become pregnant later in the breeding season. And one of the reasons why you're not going to notice or you're not going to see this is that these fetuses at these stages are very, very small. So this picture here is a 42-day fetus inside the placenta, and it's about 1 finger in diameter. At 35 days, it's a half a finger in diameter. So again, most of these will be reabsorbed but even if they do pass them to the outside of the animal, they're so small that you're not going to be able to notice them. And again, they're going to return to estrus. If you notice you have animals that are actually, when they were bred, and now you're seeing that they're coming back in standing heat in that 30 to 35 day range or so, that's a relatively good indication that they actually were pregnant and they had early embryonic death, and they lost the fetus after maternal recognition of pregnancy. So it's kind of a good thing to be on the lookout for. Causes early embryonic death. We believe that 90+% of them are due to developmental issues. And all that means is we've got a sperm and an egg that join together, and they divide, and we're just doubling our cells. And eventually the cells have to differentiate. Some have to become hair, some have to be cardiac tissue, some have to be nerves. And if all of that is not working to produce a normal calf, our belief is that Mother Nature recognizes that and those fetuses will die. And it is pretty amazing the few number of calves that are born with developmental issues. We always see them every year, the calves that are deformed when they're born, but in relation to the number of calves that are born normally, it's pretty low. And so we believe that most of those fetuses are actually not allowed to continue to grow early on the developmental stage. Some of the diseases that cause early embryonic death: BVD, lepto, Neospora, which is a protozoa. And then we've in practice and occasionally we'll diagnose where it's actually a human issue, where somebody thought they were given a vaccine or something, but they were giving a product that's going to cause abortion, such as Lutalice or Estromate or something like that. So those are the primary issues we see with early embryonic death. Abortion, again, is 42 days to term. Again, you may not know recognize what's going on here as abortion, because a 60-day fetus is only the size of a mouse, and a 90-day fetus is the size of a rat. And if there's any coyotes or anything out there, those things are gobbled up pretty quickly. Most of these animals that abort in this kind of relatively early stage of abortion, they'll return to estrus in a few days to a few weeks. It'll take them a little time to clean up. A couple diseases, trick and campy, which is Campylobacter, which is the old Vibrio. A lot of times those animals are going to take months before they'll be able to become pregnant. And so there is a little differentiation there. Some of the abortion causes, there's lots of species of bacteria, and most of our bacteria, except for the lepto, they would be an abortion here and abortion there. We rarely ever see abortion storms due to bacteria. We see a lot of mold abortions, and the sources are silage, hay, cake, or cubes. And animals can become infected and then cause an abortion by either ingesting the mold, by eating the silage or the cubes, or most of them probably become infected when they inhale the molds, goes into the lungs, passes into the bloodstream, and then the mold crosses into the placenta, into the fetus. Nitrates, I'll show you some data. Nitrate is a relatively common cause of abortions in the Midwest, at least through our laboratory. These are cases where the nitrate level in the feed is not high enough to cause clinical signs in the adults, in the cows and the heifers that are pregnant, but there's enough nitrate that it crosses the barrier and causes an issue with the fetus. Vaccine, we're hoping it's decreasing through time, but in the past few years, more and more vaccines that are modified live that contain IBR, labeled for use in pregnant animals, were used. If those pregnant animals had not been previously vaccinated with the same product in the previous 12 months, it put them at risk of having an IBR abortion. And we routinely used to diagnose vaccine-induced IBR abortions in the Midwest. IBR, just a field exposure, doesn't have to be in the vaccine. IBR is probably in every herd. We do diagnose a fair number of just field exposures. Lepto's a bacteria that we see quite a bit of. It's carried by quite a bit of wildlife, including deer. And so we see that especially where there's high concentrations of wildlife. And then of course, BVD 1 and 2, already mentioned Neospora. And then the other thing that we see in abortion is primarily protein and energy deficiencies. Less or so maybe trace mineral and vitamin. Trace mineral and vitamin are typically what we see would be more of a stillborn weak calf syndrome, but protein energy deficiencies in the diet are certainly a cause of abortion that we diagnose every year. Just this is a table to show what stage of gestation these infectious causes, the major infectious causes are. So we've got IBR, BVD, lepto, Vibrio, which is Campylobacter, trichomoniasis, and Neospora. All of those can cause early abortion. So we're talking the first trimester. And then Vibrio and Trich, they rarely cause any issues past that, but our other pathogens can cause abortion other stages of gestation. So the key here is that we really can't determine because of when the calf was lost to what organism is involved, because most of them can cause the issues all the way along. The green stars are just a recognition that those are organisms or things we certainly want in our vaccines to protect against, so that we're not having reproductive issues. This is results from our laboratory at K-State, from the abortion samples that were sent to us. It represents several hundred, and just a breakout of the ones that we've got a diagnosis. You can see the big ones down here at the bottom. Almost 30% of the abortions we diagnosed were BVD associated. Another almost 30% were Neospora. I won't get into it, but I think Neospora is maybe overdiagnosed. That's just a little note to me. See nitrates at about 10%. IBR at 6, and then fungal at 6. So these are the top 5 for last year of the abortions that we actually had a diagnosis. Now I threw in 2018 results. We do this summary every year, and there's a difference. You can see how IBR is much, much higher, BVD's lower, Neospora is about the same. But the point of showing you these two graphs is that the trends change, and I think they change year by year. So we can't. I think our goal is to try to concentrate on minimizing the disease or abortions due to the major diseases the best we can, and not concentrating on just one area or another area. So it's important we kind of have a broad spectrum prevention program for reproductive issues. So how do we diagnose pregnancy losses? It can be very, very difficult. Pregnancy histograms are helpful, and they're becoming more used. And here's an example of a histogram. So basically at the horizontal axis, these are the percentage of animals that were pregnant, became pregnant the first 21 days of the breeding season, second 21 days, third 21 days, and then the percentage that were open. And the way these histograms can be basically produced is that if we preg check early and we can actually stage the level of gestation, we can calculate these. Or from a calving book, we can actually go back in time and say, okay, they calved here. This is likely when they were bred. And so there's two ways to put these numbers together. Ideally, this is what it would look like. We'd have a vast majority becoming pregnant the first 21 days, a fair number the second, less the third 21 days. And that makes sense. We want more pregnancies early. And then for most of us, anything under about 5% open is a pretty good goal for most herds. So that's normal. Here's you can see this is a little bit different than the last one, other than they got a lot pregnant in the first 21 days, a little bit less in the second, but they 15% open. So what happened here were the neighbors' bulls got into the pasture during the second 21-day period, and the first bull and the other bulls were actually positive. So they didn't enter the herd until the second 21 day, and that's what produced this pattern. And again, histograms I think are very, very important, but without having a history of what went on, I don't think we can actually look at patterns and determine exactly what the issue was when it occurred. Here's another example, very poor reproductive. Most of the animals basically didn't become pregnant. We had 53% open here, just poor all the way through. And what happened here were that multiple bulls in a single pasture were already infected with trick at turnout. So the previous one was a trick issue. This is the trick issue. The patterns are totally, totally different. So without knowing what went on in both of those herds, I'm not sure that these would have helped us diagnose the issue. And then another one just to look at, not very good. First, instead of a 65 or 67, we're down to 48% pregnant in the first 21 days. Big increase compared to normal in second, and then lesser. And what happened were this was in a one pasture. 5 bulls were put in the pasture. 3 of those were treated for foot rot 2 weeks into this session. So we basically had 2 bulls that were doing most of the work in the early breeding season. And then the foot rot bulls recovered, and they compensated for that as we passed through. So again, these can be helpful, but without having an astute producer that had good records to say this is what happened, it would be pretty hard to determine exactly what went on in this herd. This is similar to the last graph, and this is just that 85% of the herd. This is relatively rare, but 85% of the herd were in very poor body condition at turnout. And so until they got into a positive energy balance and the grass kind of took over, their reproduction early was not very good, but they did kind of compensate as the grass helped their nutritional and their reproductive efficiency as we went on. Okay, other diagnostics that we can use. if you haven't been around a lot of aborted fetuses, especially ones that are late gestation, this is a normal appearance of an aborted fetus. And if you haven't opened a bunch of calves or cows, you may not appreciate this, but these tissues are extremely red, and there's a big blood clot here over the kidney. And then this is the thoracic cavity over here on the left. Huge amount of red fluid in the thoracic cavity. This is a normal appearance of a bovine abortion. And so looking at this gives us no indication of what the cause was. All we know is that this calf was aborted, maybe a stillborn, but certainly aborted in late gestation. And so totally different appearance than if we're opening up a calf or a cow as far as the way the organs appear. So one of the great questions we always get is, should we be doing a diagnostics on every aborted fetus? And a typical abortion workup is going to cost $120 to upwards up to $300, depending on how deep we need to go. And so I don't think any of us would recommend that on your first abortion in your herd that you do diagnostics. Sometimes it is relevant, but I do like to recommend that the abortion, that fetus and the placenta are saved, not necessarily sent in for diagnostics, but just saved in case we have more. And I'll show you here in a minute, the more fetuses and placentas that can be used in the diagnostics, the greater the probability that you'll actually get a diagnosis. And so you can even freeze the fetus, freeze the placenta, just keep them chilled and just see what happens over the next few days to make sure that we're not in the beginning of an abortion issue. The best diagnostic samples would be the entire fetus and sections of placenta. Certainly don't expect somebody to ship a fetus for $80 or $100 from Western Kansas by UPS. And so those type of fetuses, necropsy can be completed, and the veterinarian needs to take every single tissue from every single organ, from the brain all the way through the skeletal muscle, except the intestines. The intestines are not very helpful for abortion workups. So this is, we monitor this every year, and other state laboratories around North America that we work with have the same basically numbers. But if one fetus is submitted, about 30 to 50% of the time, you're going to get a diagnosis. And that's why it's a very frustrating thing to work up, because typically you're going to get a diagnosis between 30 and 32% of the time, year after year. And it, like I said, it can be very, very frustrating for both producers and practitioners and diagnosticians. I mean, we find it very frustrating. But if you send 2 fetuses in with placenta, you increase the probability of a diagnosis by 1.5 times. And so that goes back to, should we send in the first one? No, but maybe if we save back the samples, save back the fetus, we can send in 2. We're going to increase the odds of really finding out what happened in the abortions. The placenta is probably the most important tissue to send in. Year after year, again, we monitor this. If the placenta is included in the submission with either the fetus or the fetal tissues, it increases your probability of a diagnosis 4 times. And the key is, here's a picture of the placenta, and these red structures here that's where the placenta was attached to the uterus. And what we want is a hunk of the placenta, not just one of these areas like this. And the reason is, what the pathologists are going to look for in these tissues is not uniform, meaning they might be, the organism or the inflammation might be localized. And so a big hunk of placenta is very, very important. Realize that's not always possible. We don't always know who aborted. Sometimes we can't get them in. But even if the placenta's been there for days and it's rotten, it's dirty, there's a huge diagnostic value to including that in the submission. One of the things, especially as a practitioner, found very, very frustrating were animals that were declared pregnant, diagnosed pregnant, and now they're open. We don't have a fetus. We don't have a placenta. And so some of the things probably should think about or talk about when those instances occur is what stage of gestation were they when they were pregnancy checked? And I showed you that most of the losses are in the first 60 days, normal losses. So if we're preg checking early, and that's common on dairies and becoming more and more common on beef herds, if we're checking 45 to 60 day pregnancies, we're going to lose just through normal attrition a percentage of those fetuses. And so that's going to be totally different than if we're preg checking at 150 plus days, where we shouldn't be losing hardly any of those fetuses. So that's one of the questions. Do we preg check early? And then the other questions are, how competent was the person that palpated or used the ultrasound? Because we've had cases where it was just misdiagnosed. And then, are you using a blood test or a milk test? And this is a table to compare the major ways that pregnancy can be determined. Rectal palpation, which would be an arm in the rectum and using the hand, ultrasound, blood or milk, looking for a protein. There's two tests out there for that. Here's the minimum days of gestation when we can start preg checking. So rectal palpation, ultrasound around 30, and blood earlier, and that's the advantage of these particular tests. But what I want to concentrate on are the false positives over here. So the false positive would be what percentage of those we called pregnant were actually open. And lots of studies, but less than about 1/10 of 1% of all the animals by competent people that rectally palpate or ultrasound, when they call them pregnant, are actually open. So very, very low false positive rate. Our blood or our milk proteins up to 5%. So if we sample 500 cows, and let's say all of them are pregnant on the blood, we can expect about 5% are actually open. And some of that's because they've already lost the fetus and the proteins that are circulating in their bloodstream are still there. Or again, we're checking very, very early. There's just going to be some attrition there. So that's one of the questions to think about, is what test we're using and how competent are the people that are making the diagnosis. Some of the things that even worse, or if we look preg check, say in October, very, very confident that they were truly pregnant. And now the calving season starts, they're not springing, they're not uddering up. And now we confirmed them. They certainly are open. So something happened. We don't know when, but again, we don't have a fetus and we don't have a placenta. And those are really the samples that we like for diagnosing an abortion. It's obvious these animals aborted. So now what can we do? And what we can't do is really eliminate several things like nutritional or genetic or toxic insults, because there's probably been a very large lag time from when the insult occurred to when the fetus was lost. And so those are the things we can't diagnose. What we can do by taking serum from some of these animals is actually look at the antibody levels for our major infectious causes, the IBR, the 2 BVDs, and the lepto, by taking samples from 3 to 5 of the open cows or heifers, and then optionally 3 from the pregnant animals, and just having the antibody level assessed. We can determine whether, yes, it looks like we probably had a lepto insult. This is not normal vaccine, and those kind of things. So if we have a good vaccination history from the serum, again, we can rule out or probably rule in those major infectious causes of abortion. And other than that, there's not a whole lot that we can do. Prevention, there's not a whole lot we can do prevention-wise either. Biosecurity is huge. Several of these diseases we deal with in particular are probably on every operation, but like the BVDs and the tricks and some of those are not. And so if we're bringing animals from outside in, it is important that we try to quarantine them for 30 to 45 days before they're exposed to our breeding herd. And that'll allow them, if they are actually carrying one of these organisms, to clear the infection. And that way they're not exposing your home raised or your home herd to these diseases. And then of course the vaccination program. And again, we talked about this earlier, but these would be the basic organisms, the IBR, the 2 strains of BVD, lepto, Campylobacter. All our vaccines have a V, and it stands for Vibrio. That's just the old name for Campylobacter. But this vaccination program, at the very least, should have these organisms in there for protection of your cow herd or your heifers. And then nutrition. We talked about how we do see a fair number of protein and energy, late-term abortions, stillborn, and those kind of things. And so it's really, really important that the forages are all tested, analytically tested for nutrient content. And then someone that with experience and expertise in diet formulation formulates a diet that's appropriate for the different stages of gestation for these pregnant animals. And, as they get into the 3rd trimester of gestation, their energy and protein requirements basically are 10 times higher than they were 3 months before that. And so having a diet appropriately designed and fed to the cows is extremely, extremely important. That's all I have. You want me to stop screen sharing now?
We can keep that up, or we can, that's perfectly fine.
Okay.
We can open it up to questions. If anybody has a question, feel free to add it into the chat, or with the size of group we have, you feel free to unmute yourself and ask your question yourself if you would like.
Greg, this is Clint Laughlin. Can you hear me okay?
Yes, I can.
Okay, Greg, thanks for your presentation this morning. Thought it was really good. Just a question for you. Given the data that you presented this morning, do you have a timing recommendation on when people should be preg checking?
Oh, that's a great question. And really, for me, it depends on what fits best for their management style. I mean, sometimes it's important that we know early on, we'll say whether we have AI pregnancies versus natural breeding. Sometimes producers will want to separate those out that are going to be late calvers and maybe send them to stocks or those kind of things. So I think it just depends. And a couple things. One is that whoever's going to do your preg check, can they do it early if that's what you want? And then if you're preg checking at 45 to 60 days, just remember, and that's your breeding season is over, just remember you're going to have a few, not all the time, but you're going to have a few that probably end up open. And so I think it just depends.
Okay, great. Thank you. It does look like we have another question in the chat here. Their question is, how important is the timing of vaccination?
Well, that's another great question. So at least for most of us, and there's no set vaccination program that's appropriate for everybody, but for most of us, we are going to want our vaccination for reproductive issues in the cows 30 to 45 days prior to the breeding season. And we want the maximum number of antibodies produced during the early part of the breeding season, because that's when we want to get most of our animals pregnant. And so we need to give them 30 to 45 days time to build the antibodies. Plus our modified live vaccines have will reduce fertility maybe for a little bit in these cows for a few days. And so most of us, we want to vaccinate pre-breeding. And then the question is, do we need to booster pregnant cows? And I think that's the question that is really unanswered, because I showed you using Modify Live in pregnant cows. They haven't been vaccinated is a little bit dangerous, but there are downsides of going to a killed vaccine after a Modified Live too. So certainly start with pre-breeding vaccination would be our recommendation.
Okay. And then just another question on my side too. Do you have any recommendations on what people should be taking down or keeping track of from a record keeping standpoint?
Well, I guess just about anything that they notice is not normal, and it's the big things, like those histograms kind of shown is we go out there and we've got a bull with foot rot. I would just probably write down in my calving book that bull 514 had foot rot, and just keeping little indications of that. When we had eye problems, I'd probably put that in there as a calendar date of when our problem started. Just any health issue basically, or I tell you, in parts of Kansas, we've had such a trick problem. I would certainly write down anytime a neighbor's bull was noticed in our pastures, or if our bull or bulls or cows got into the neighbor's pasture, I would certainly write that down somewhere as far as a calendar date. And that would help with diagnosis in case there is an issue down the road.
Makes sense. Okay, thank you.
You bet.
That's the only question I've got right now in the chat. Is there any other questions for Doc that people have at this point? Okay, what about my other colleagues? Anybody of you guys? Okay, thanks, Doc. I really appreciate your time this morning.
You bet. Thanks for the opportunity. We'll talk to you later.
Okay, sounds good.
Thank you very much, Greg. We
You bet.
really appreciate it. And with that, if we don't have any other comments or questions, thank you for attending once again next week at 10 o'clock, sorry.
Yep.
We will have our next one. Oh, and I can. Oh, there. Our next one is Thursday, February 11th, post-calving nutrition with Dr. Dale Blasi. So we hope to see you all there. Thank you for attending today.
And I did post,
Yeah, there you go, Brett.
I was gonna say, I did post the link in the chat. If you could just fill that out, it's an evaluation. It won't take but a couple minutes of your time. It helped us out on our programming, and just let us get us some feedback on what we're doing right and what we're doing wrong and who we're talking to, and it just gives us an idea of where to go with our future programming. Okay.
Don't put Clint in there in the waiting room. For some reason, Clint, you are not a co-host. I think it's because I couldn't